This is the shoulder blade, or in other words, what we call scapula. The scapula is the bone that fits right about here, visually on the posterior view, and moves according to the movement of your arm. This is the root of your upper limb. This is the bone that allows free movement of your arm. The scapula is the second bone in our upper limb series after the clavicle. So let's make you an expert on the scapula by going through its parts, borders, and surfaces. What's up everyone? My name is Taim. I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you would like a PDF version or a quiz of this presentation, you can find it on my website, along with organized video lectures to help with your studies. Alright, let's get started. Let's first test your visual memory. Are we looking at the bone from the backside or the front side right now? We're looking at it from the posterior view, or the backside. So we will cover all the parts of this bone while viewing both the anterior and the posterior side. And the first part of this bone that I want to start with is the coracoid process. This outgrowth is the coracoid process. The coracoid process is a bony projection on the anterior surface of the scapula. It do look like a bent finger pointing forward and a bit laterally. The name coracoid means like a raven's beak in Greek. Anyways, it works like an anchor point. First, for the pectoralis minor, as you see here, this muscle originates from the 3rd to 5th rib and inserts directly onto the coracoid process. It pulls the scapula forward and downward, stabilizing the scapula during upper limb movement, like pushing or reaching forward. The other muscle that attaches to it is the short head of the biceps muscle. Yes, your biceps has two heads. The short head originates from the coracoid process, while the long head comes from inside the shoulder joint at the supraglenoid tubercle. Together, they flex the elbow and help with forearm supination. But the short head also plays a stabilizing role for the shoulder anteriorly. Next landmark is very prominent from the posterior view. It's first the spine of the scapula, which continues laterally, and just at the point where it bends, we call this the acromial angle. This marks the transition between the spine and the acromion. Now, the acromion itself is a flat, bony part that forms the highest point of the shoulder, and it articulates with the clavicle through something called the clavicular facet. Another anatomical structure is just below the spine of the lateral edge. You will find the deltoid tubercle. This serves as a site where the deltoid muscle originates. Okay, let's add some structures to see how it looks. Here we see the deltoid muscle. This powerful shoulder muscle originates from the clavicle, the acromion, and the spine of the scapula, including the deltoid tubercle we just mentioned. It inserts on the deltoid tuberosity on the humerus, and its primary function is to lift your arm to the side. The trapezius muscle is another one here. It's a large superficial back muscle that also attaches to the spine of the scapula and the acromion. It elevates, retracts, and rotates the scapula. Together with the deltoid, it forms the shoulder contour. If we now turn this image to the front, we can see the clavicular facet articulating with the clavicle, with an acromioclavicular joint between them. This joint is involved every time you shrug, raise, or rotate your arm. Another thing is, a structure that might not get as much attention but is super important is the coracoacromial ligament. It runs from the coracoid process to the acromion, forming the coracoacromial arch. Why is it important? It's important because it acts as a protective roof over the head of the humerus. It prevents superior displacement of the humeral head. Basically, it keeps your shoulder joint from popping upwards. Alright, let's keep this going. We're now focusing on the posterior surface. Above the spine is the supraspinous fossae, and below is the infraspinous fossae. These depressions function as beds for certain muscles, and these muscles are the supraspinatus muscle, which sits on the supraspinous fossae. This is one of the 4 rotator cuff muscles and initiates shoulder abduction, helping the deltoid kick in. Below that is the infraspinatus muscle, sitting on the infraspinous fossae. It's also part of the rotator cuff, and its job is external rotation of the humerus. Together, these rotator cuff muscles stabilize the glenohumeral joints, holding the head of the humerus firmly against the shallow glenoid cavity of the scapula. Okay, awesome. Another shallow depression we have is on the front side, called the subscapular fossae. This anterior surface of the scapula forms a bed that contains a muscle, and that muscle is called subscapularis. As you see here, it sits perfectly over the subscapular fossae. This is the largest and most powerful of the rotator cuff muscles. and its main job is internal rotation of the humerus, and it also helps hold the head of the humerus firmly into the glenoid cavity, especially when you lift your arm up above your head. If this muscle is torn or inflamed, it can significantly reduce your arm rotation and contribute to instability of the shoulder. Now, just medial to the glenoid cavity is the neck of the scapula. It's a narrowed region that helps support the glenoid like a stem supports a flower. The glenoid cavity itself is the pear-shaped articular surface that connects with the head of the humerus to form the glenohumeral joint. This is the shoulder joint and is the most mobile joint in the human body, and that mobility comes at the cost of stability, making it one of the most common dislocated joints. We will pull back here to see the glenoid cavity in context. This cavity is bordered by two small but significant tubercles. Just below the glenoid, we have the infraglenoid tubercle. This is where the long head of the triceps brachii originates. It's the only head of the triceps that crosses the shoulder joint and is involved in elbow extension and shoulder stabilization. Now, above the glenoid cavity, we have the supraglenoid tubercle, and this is where the long head of the biceps brachii originates. Remember earlier we talked about the short head originating from the coracoid process? These long heads take a more centric route, passing through the shoulder joint capsule and the intertubercular sulcus of the humerus. Because of that, it's often involved in shoulder pain, tendinopathy, or even dislocation when the labrum is torn. It's what we call slap tear. Now, another landmark we can see on the scapula is the spinoglenoid notch. This notch lies just under where the spine of the scapula meets the glenoid, and it serves as a passageway for the suprascapular nerve and vessels as they make their way to the infraspinatus muscle. Okay, now let's look at the edges of this bone. Superior of the scapula, we can see the superior border, and we can see the suprascapular notch. This notch is bridged by the superior transverse scapular ligament, which converts it into a foramen. The suprascapular artery and vein passes above this ligament, while the suprascapular nerve passes underneath it. A nice clinical mnemonic here is Army over Navy, so artery over, nerve under. Another thing here, we can see the inferior belly of the omohyoid muscle attaching to the superior border of the scapula. It crosses the posterior triangle of the neck and serves as an important surgical landmark, although functionally it helps with depressing the hyoid bone. Now, let's look at the rest of the angles and the borders that define the shape of the scapula. The superior angle is where the superior and medial borders meet. The medial border, also called the vertebral border, runs along the edge closest to the spine. The inferior angle is the lowest point of the scapula and is easily palpable. And finally, the lateral border runs upwards towards the glenoid and provides attachment to several muscles. Speaking of which, let's now bring in some of the muscles related to these landmarks. At the superior angle, the levator scapula inserts and helps elevate the scapula. Running along the medial border, we have the rhomboid minor and rhomboid major, which retracts and rotates the scapula. The anterior surface of the medial border is where the serratus anterior attaches. This muscle is important for protraction and rotation of the scapula, and weakness here causes scapular winging. On the lateral border, we find the insertion of the teres major and teres minor. The teres major assists in adduction and internal rotation of the humerus, while the teres minor is part of the rotator cuff, helping with external rotation and joint stabilization. So that's it. If you're still here, good job. Try reviewing all parts of the scapula and see if you remember everything. So we've now covered all the landmarks and parts of the scapula. It comes right after the clavicle in our upper limb series. In the next video, we will focus on this area shown in red, which is the shoulder joint itself, and talk specifically about the glenohumeral joint and in more depth about what the rotator cuff actually is and how they provide stability to the shoulder. Click the next video and I'll see you there. If you want handmade PDF version of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you can find everything on my website. Thanks for watching, see you in the next one.